Hey everybody, this is Kelly. Welcome back to another episode of Ask a Therapist. We are continuing our Pride series with a question that I have received and have a lot to say on, so I'm going to try to keep it as short as possible, but it's about conversion therapy. And the question specifically was, how do I speak to people who think that conversion therapy is okay? How do I handle the fact that these people are in my life? I'm going to go a little broader with the actual topic itself and give you a little bit of an explanation on what conversion therapy is, because I think there's some misunderstanding about that out there, and we will go from there. Okay? I feel like this series of videos is going to get me in a whole lot of trouble with a whole lot of people, but here's the thing. If this saves lives, here I am. First off, the definition. Conversion therapy is any attempt to change someone's gender identity, someone's sexual orientation, or someone's gender expression. Any attempt to change any of those things about someone. When it comes to conversion therapy, there are some misunderstandings. Some people, other therapists that I know, will say things like, if someone comes into me and they are struggling with same-sex attraction, which by the way is a buzz phrase for something's wrong with them. If I have a client that comes into me and is struggling with same-sex attraction and they say that they don't want to be anymore, then I'm going to help them to get to a place where they don't have that issue. The bigger picture problem is the understanding that conversion therapy is based on. So the idea that conversion therapy is based on is the assumption there is something inherently wrong with being non-straight or non-cisgender. That's a problematic assumption to go from. That is an old assumption that has been repeatedly removed from understanding within the medical community for years. I mean decades, There's no peer-reviewed scientific research that validates conversion therapy. There's none. And anyone who tells you otherwise, my suggestion would be to ask what they're quoting. Maybe ask them if you could see it, not in a way that makes things combative and not in a way that makes things, The fact is, arguing with someone who believes in conversion therapy is going to be frustrating if you are somebody who is either a member of the LGBTQIA plus community or someone who considers himself an ally to same community. Arguing with someone who believes conversion therapy is a viable option for human beings in our world today is going to be frustrating at best. So again, I want to explain to you just how damaging conversion therapy is and just how widespread it is. It is very easy for people who are straight and cisgender to not understand how relevant this actual topic is and how many people are sent into these circumstances, either with a private practice or with a clinical practice, of people who believe there is something inherently wrong with being gay or being transgender or essentially anything that's not cisgender or heterosexual. Conversion therapy is harmful because it has statistically been proven, scientific, peer-researched proof that people who endure conversion therapy are 8.4 times more likely to have attempted suicide. Let me say that differently. People who have gone through conversion therapy are 8.4 times more likely to report having attempted suicide than those who live in accepting or mostly accepting homes. People who've endured conversion therapy are 5.9 times more likely to report high levels of depression. Those levels are high to begin with, and adding on to that 5.9 times because of the guilt and confusion that they carry around because of conversion therapy. Those who go through conversion therapy are also 3.4 times more likely to use drugs, 3.4 times more likely to report having a sexually transmitted disease. They are more likely to engage in risky behaviors. And a lot of that is because the efficacy of conversion therapy is widely disputed, which it shouldn't be, because There are no stats proving that it's in any way effective, but for some reason we still talk about this. So let's talk about it. It is not possible for us to quantify in any real way the psychological damage that conversion therapy does on a human being. If you are someone who has had to endure conversion therapy, either through your own purposes or because someone else forced you into it, or because you went to see a therapist and didn't realize that you were in conversion therapy, you need to understand that it is not your fault. You need to understand, I want you to understand that it is okay to be confused and it is okay to be angry, because in reality, as a therapist, it is never our job to instruct the client. Our job is to create a space where the client can be and where we can meet the client. Yes, sometimes through our own lens, absolutely. But specifically where we can understand the client's lens, help the client to understand their lens, and to move forward into a more whole and complete human. The baggage that we bring into the room does not have any place in those conversations. Therefore, if a therapist, if a licensed practitioner has said to you there is something unacceptable about your attraction or your identity, they are breaking the law. Unfortunately, 41 states in our country still allow conversion therapy, largely due to a very loud, very financially lucrative relationship with some pretty conservative Christian entities. It's not ethical for me to walk into a session with a client and push my agenda or my understanding of complete whole personhood onto them. That's not ethical. If it is not possible for me to remain objective in the room with my client, it is my requirement. I am required to refer for my client's sake. Not doing so is unethical. The idea of conversion therapy comes from a group of people who a lot of years ago decided that it was in their best interest to vilify, at that point, gay men as a destructive force on the idea of the family structure, and as degenerates, as people who don't understand the law. There was a point in time in our country where it was illegal to be gay. In order to get a law like that passed, you have to work on some pretty hefty assumptions about the nature of same-sex couples or same-sex relationships. People who experience realities and relationships outside of the cisgender, heterosexual, normative understanding of relationships and identity are not broken. They are not criminals. They are not to be fixed. All of those things are about the comfort level of the majority. I'm going to refer you to my last video if you need to understand a little bit more about that. Talked a little bit about allyship and the responsibility of someone in the majority who wants to be an ally to those in a minority group. You can refer to that if you need more information about that. But it is more about the comfort level and the understanding, the expectations and the rules of those in the majority than it is about the health and well-being of those in this minority. Just because you don't experience it does not mean it's not okay. That is fairly immature thinking, and that is something that becomes problematic when it's applied to people who, are living and breathing and have hearts and minds and feelings and understandings of themselves. I go back to the idea that conversion therapy was at one point very accepted and in general expected for someone who revealed that they were dealing with same-sex attraction. The APA, the ACA, tons of organizations that make the entirety of their job is to understand mental illness, to understand the problems that mental illness can bring into someone's life, to understand everything from the chemical stuff going on in our brains and in our bodies and how that works and how that affects our mental state. People who study these things more than keyboard warriors with a Google search are telling you it is not a mental disorder. That should be enough. If it's not, the other part of this conversation, the other part of this question was, how do I speak to people that I care about who believe that conversion therapy is okay? I'm going to tell you the same thing that I tell anybody who is in the middle of any kind of a push-pull with someone whose ideology is so vastly different from theirs. My question is more for you. Tell me what your objective is in going into the conversation. Are you going into the conversation because you know of somebody that they are putting through conversion therapy, that you are trying to be an advocate for them? That's a different conversation. If you're just having the conversation because it comes up, why are you having the conversation? If they have already proven to not be interested in being educated about the real issues, it is completely possible for you to disengage in those kind of conversations if you know they are going nowhere. If you want to engage in the conversations and it's genuinely about respecting the relationship you have with that person, then I would suggest a couple of things. One of the things is to ask them in a non-aggressive, non-offensive, not in your face way to cite their sources. Ask them to prove their work. They're saying conversion therapy is fine. They're saying that it is normal. They're saying that being gay is not normal. Okay, where do you find this information? What is it that we can both look at and we can say, okay, you see it this way. This is how I see it. And not in an effort to change their minds, but in an effort to have a longer conversation about why this practice needs to be abolished completely forever, because it does. We will always have people who disagree with us. We will always have people who see things in a different way. When the disagreements and when the seeing things a different way becomes a mental or physical problem for you, that is when you have an obligation to make some decisions. That is when you have an obligation to yourself, to those who do support you, to those who do love you, to the people who count on you, to yourself, again, yourself, to decide how much of that you allow to stay in your life and how much you don't. And then to be okay with your decision and to be okay with the fact that you can change that decision anytime you want to. It's your life. You get to change it. You can decide one day this person is somebody I want to keep in my life and then at some point have enough. You have that right. And the fact is recognizing that you have that right to choose who you have in your life and who you don't have in your life. Understanding that that is a right that you have is a fundamental step to understanding why conversion therapy is wrong, because conversion therapy attempts to remove that right from people's lives. People who don't get why conversion therapy is wrong are also not going to understand why you have the right to take them out of your life. While it is not your job to educate people on this, because the information is readily available, a very quick Google search, less than 5 minutes, will show you all of these stats from peer-reviewed, researched, published articles, published studies that show you that the efficacy of conversion therapy is none. It's not effective, because even coming out of it, those who say they do not continue to have same-sex attraction, and I keep using that phrase because that is the phrase they use. People who come out of conversion therapy without same-sex attraction typically go back to having same-sex attraction within 5 years. So how effective is tearing apart someone's life and someone's understanding of themselves if that's where they go? So we've gone over what conversion therapy is. We have gone over the statistics of conversion therapy and those who come out of conversion therapy. We've also gone over the understanding of how to have a conversation with those who do not agree with you and those who maybe don't have any actual interest in hearing why you think the things that you think. Ultimately, the response to this particular question is this: there is more than enough information out there for people who are willing to see it, that conversion therapy is dangerous, that protecting it is dangerous, and ignoring that within the mental health community is something that I personally also find dangerous. I hope that you've been able to glean something from this, if not just statistically and the things that are problematic about conversion therapy, but also about your rights, either as a client or as someone who loves someone who has been put into conversion therapy. Stay tuned for our next installment of our Pride series of Ask a Therapist, and I will see all of you soon. Take care.